Question 1. What is the immediate first action a rescuer should take upon arriving at a potential emergency scene? A. Begin chest compressions. B. Activate the emergency response system. C. Ensure scene safety. D. Check for responsiveness. Answer: C. Ensure scene safety. The concept tested here is the very first step in any emergency situation: scene safety. The keyword immediate first action highlights the critical importance of ensuring the environment is safe for both the rescuer and the victim before doing anything else. You cannot effectively help someone if you yourself become a victim. For example, if someone collapses in the middle of a busy street, you must first ensure traffic is stopped or move the person to a safer location before beginning care. Always remember, your safety comes first because you can't help others if you're injured. Question 2. For an adult requiring CPR, what is the correct compression depth? A. At least 1 inch 2.5 centimeters. B. At least 2 inches 5 centimeters. C. No more than 3 inches 7.5 centimeters. D. About 1.5 inches 3.8 centimeters. Answer: B. At least 2 inches 5 centimeters. This question focuses on the technical skill of high-quality chest compressions for adults, specifically the appropriate depth. The phrase correct compression depth is a key clue, guiding you to recall the specific measurement required for effective blood flow. Compressing the chest at least 2 inches allows for adequate blood circulation to vital organs like the brain and heart. For example, imagine trying to pump water through a hose. You need enough force to make the water move effectively, just as you need enough depth to circulate blood in CPR. Remember to push hard enough to make a difference, but not excessively deep. Question 3. What is the recommended compression rate for high-quality CPR in adults, children, and infants? A. 60 to 80 compressions per minute. B. 80 to 100 compressions per minute. C. 100 to 120 compressions per minute. D. 120 to 140 compressions per minute. Answer: C. 100 to 120 compressions per minute. This question tests your knowledge of the correct speed for chest compressions, a crucial component of high-quality CPR for all age groups. The recommended compression rate refers to how quickly you should be pushing on the chest. A rate of 100 to 120 compressions per minute ensures that enough blood is circulated consistently to maintain vital organ function until advanced help arrives. Think of it like listening to a fast-paced song. Maintaining that consistent, rapid rhythm helps you stay on target. Always aim for quick and steady compressions, without going too fast. Question 4. When providing single rescuer CPR to an adult, what is the correct compression to ventilation ratio? A. 15 compressions to 2 breaths. B. 30 compressions to 2 breaths. C. 30 compressions to 5 breaths. D. 15 compressions to 1 breath. Answer: B. 30 compressions to 2 breaths. This question assesses your understanding of the proper ratio for providing effective CPR to an adult as a single rescuer. The single rescuer CPR and compression to ventilation ratio are the key terms that point to the specific guideline for balancing chest compressions with rescue breaths. For adults, the emphasis is on compressions, so 30 compressions followed by 2 breaths ensures maximum blood flow while still providing necessary oxygen. For instance, after pushing 30 times quickly and effectively, you pause briefly for 2 quick breaths. Always prioritize compressions, but don't forget those vital breaths. Question 5. How long should you check for a pulse on an unresponsive adult victim? A. At least 10 seconds, but no more than 20 seconds. B. At least 5 seconds, but no more than 10 seconds. C. No more than 5 seconds. D. Exactly 10 seconds. Answer: B. At least 5 seconds, but no more than 10 seconds. This question evaluates your ability to quickly and accurately assess an unresponsive victim, specifically the duration of a pulse check. The phrase, "How long should you check for a pulse?" emphasizes the importance of a swift but thorough assessment. Checking for at least 5 seconds but no more than 10 seconds ensures you don't waste precious time delaying CPR if a pulse is absent, yet provides enough time to detect a faint pulse if present. For example, quickly feel for the carotid pulse in the neck, counting 1001, 1002 for about 10 seconds. Remember, time is critical when someone isn't breathing or has no pulse. Question 6. Where should the AED pads be placed on an adult victim? A. One on the right side of the chest, one on the left upper arm. B. One on the upper right chest, one on the lower left side of the rib cage. C. Both on the left side of the chest, one above and one below the nipple. D. Both on the back of the victim. Answer: B. One on the upper right chest, one on the lower left side of the rib cage. This question focuses on the correct anatomical placement of AED pads for an adult, which is essential for effective defibrillation. The AED pads and adult victim clues guide you to recall the standard anterolateral placement. Placing one pad on the upper right chest, above the nipple, and the other on the lower left side of the rib cage, below the armpit, ensures the electrical current passes directly through the heart. Imagine drawing a diagonal line across the chest, with the heart in the middle of that line. Proper placement maximizes the chance of the shock reaching the heart and stopping the abnormal rhythm. Question 7. What is the primary indicator that an adult victim requires CPR? A. They are unconscious and breathing slowly. B. They are unresponsive, not breathing, and have no pulse. C. They are gasping for air and have a weak pulse. D. They are responsive but have a very fast heart rate. Answer: B. They are unresponsive, not breathing, and have no pulse. This question tests your ability to identify the critical signs that necessitate starting CPR. The primary indicator is the key phrase, pointing to the combination of symptoms that define cardiac arrest. An adult who is unresponsive, not breathing normally, or not breathing at all, and has no pulse is experiencing cardiac arrest and requires immediate chest compressions and rescue breaths. For example, if you shake an adult and they don't respond, you look for breathing, gasping isn't normal breathing, and quickly check for a pulse, and find none of these, it's time to start CPR. Always remember the 3 main signs: no response, no breathing, no pulse. Question 8. When should you activate the emergency response system, e.g., call 911/EMS, for an unresponsive adult victim? A. After 5 cycles of CPR. B. After delivering 2 rescue breaths. C. As soon as you determine the victim is unresponsive and not breathing/only gasping. D. After checking for a pulse for 30 seconds. Answer: C. As soon as you determine the victim is unresponsive and not breathing/only gasping. This question addresses the critical timing for calling for professional medical help in an adult emergency. The concept is activating the emergency response system, and the keyword when emphasizes the promptness required. For an unresponsive adult who is not breathing or is only gasping, immediate activation of EMS is crucial because advanced care and defibrillation are needed as soon as possible. For instance, if you find an adult collapsed, you should check for responsiveness and breathing, and if they're not responsive and not breathing normally, yell for help, point to someone to call 911, and get an AED if available, then start CPR. Early activation saves lives by bringing advanced care to the scene quickly. Question 9. For an adult who is conscious and choking with a severe airway obstruction, what is the most effective initial action? A. Lie them down and begin chest compressions. B. Encourage them to cough forcefully. C. begin abdominal thrusts, Heimlich maneuver. D. Deliver back blows. Answer: C. Begin abdominal thrusts, Heimlich maneuver. This question tests your knowledge of how to respond to a conscious adult choking with a severe airway obstruction. The keywords conscious and choking with a severe airway obstruction mean they cannot speak, cough, or breathe, indicating a complete blockage. The most effective initial action is to deliver rapid, upward abdominal thrusts to dislodge the object. For example, if someone is clutching their throat and can't make a sound, stand behind them, place your fist just above their navel, and deliver quick, forceful upward thrusts. Never delay, act quickly to remove the obstruction. Question 10. Which of the following is a characteristic of high-quality CPR? A. Interruptions in chest compressions are kept to a minimum. B. Compressions are delivered at a depth of 1 inch for adults. C. Rescue breaths are delivered rapidly one after another. D. Compressors switch roles every 5 minutes. Answer: A. Interruptions in chest compressions are kept to a minimum. This question evaluates your understanding of the key components of effective, high-quality CPR. The phrase, characteristic of high-quality CPR, points to the factors that directly improve outcomes. Keeping interruptions in chest compressions to a minimum, ideally less than 10 seconds, is crucial because continuous compressions are necessary to maintain blood flow to the brain and heart. For example, when using an AED, compressions should continue right up until the AED analyzes the rhythm and resume immediately after a shock or analysis. Always remember that constant, uninterrupted blood flow is paramount for survival. Question 11. When assessing a child victim, what is the approximate correct compression depth? A. At least 1 inch 2.5 centimeters. B. At least 2 inches 5 centimeters. C. About 1.5 inches 3.8 centimeters. D. About 2 inches 5 centimeters or 1/3 the depth of the chest. Answer: D. About 2 inches 5 centimeters or 1/3 the depth of the chest. This question focuses on the specific compression depth for a child victim, a distinct difference from adult guidelines. The keywords child victim and approximate correct compression depth direct you to recall the Pediatric CPR guidelines. For a child, compressions should be about 2 inches deep or approximately 1/3 the depth of the chest, which allows for effective blood circulation without causing injury. Think of it as pushing just hard enough to adequately compress the chest without overdoing it, recognizing that children are smaller than adults. Always adjust your compression depth based on the victim's size. Question 12. For infant CPR, what is the correct hand placement for single rescuer chest compressions? A. 2 hands on the lower half of the breastbone. B. Heel of 1 hand on the lower half of the breastbone. C. 2 fingers on the lower half of the breastbone, just below the nipple line. D. 2 thumbs encircling the chest. Answer: C. 2 fingers on the lower half of the breastbone, just below the nipple line. This question tests your knowledge of proper hand placement for single rescuer infant CPR. The specific terms infant CPR and single rescuer chest compressions are key, as techniques vary by age and number of rescuers. For a single rescuer, using 2 fingers placed on the lower half of the breastbone, just below the nipple line, allows for effective and safe compressions on an infant's small chest. Imagine carefully pressing on a very fragile object. You need precision and appropriate pressure. This precise hand placement helps ensure that compressions are both effective and safe for the infant. Question 13. When providing CPR to an infant, what is the correct compression to ventilation ratio for a single rescuer? A. 15 compressions to 2 breaths. B. 30 compressions to 2 breaths. C. 30 compressions to 5 breaths. D. 20 compressions to 2 breaths. Answer: B. 30 compressions to 2 breaths. This question assesses your understanding of the proper balance between compressions and breaths for single rescuer infant CPR. The terms infant CPR and single rescuer highlight the specific guidelines for this age group. Similar to adults and children, the ratio for a single rescuer is 30 compressions to 2 breaths, maintaining consistency across age groups for single rescuers. For instance, after completing 30 rapid chest compressions with 2 fingers, you would quickly deliver 2 small puff breaths. Maintaining this ratio helps ensure a balance of blood flow and oxygen delivery for the infant. Question 14. What is the approximate correct compression depth for an infant during CPR? A. At least 1 inch 2.5 centimeters. B. At least 2 inches 5 centimeters. C. About 1.5 inches 3.8 centimeters or 1/3 the depth of the chest. D. No more than 1 inch 2.5 centimeters. Answer: C. About 1.5 inches 3.8 centimeters or 1/3 the depth of the chest. This question focuses on the specific compression depth for an infant victim, which is distinct from adult and child guidelines. The keyword infant and approximate correct compression depth prompt recall of the Pediatric CPR guidelines. For an infant, compressions should be about 1.5 inches deep or approximately 1/3 the depth of the chest, ensuring effective blood circulation without causing injury to their delicate anatomy. Imagine pushing just hard enough to see the chest visibly compress, without pushing too hard on their small body. Always ensure your depth is appropriate for the infant's size. Question 15. If an infant is conscious and choking with a severe airway obstruction, what is the initial action? A. Abdominal thrusts. B. Chest compressions. C. Back blows followed by chest thrusts. D. Encourage coughing. Answer: C. Back blows followed by chest thrusts. This question tests your knowledge of the specific technique for managing a conscious, choking infant. The keywords infant, conscious, and severe airway obstruction mean the infant cannot cry or make noise and requires immediate intervention. The recommended action is a combination of 5 back blows between the shoulder blades, followed by 5 chest thrusts, repeated until the object is dislodged or the infant becomes unconscious. For example, hold the infant face down on your forearm, deliver 5 back blows, then turn them over to deliver 5 chest thrusts with 2 fingers. This 2-part approach is designed to effectively clear the infant's airway. Question 16. What should you do immediately after an AED delivers a shock to a victim? A. Check for a pulse and breathing. B. Remove the AED pads. C. Immediately resume chest compressions. D. Wait for EMS to arrive. Answer: C. Immediately resume chest compressions. This question addresses the critical action immediately following an AED shock, emphasizing the importance of continuous CPR. The keyword immediately after an AED delivers a shock is crucial, as it indicates no delay should occur. The guideline is to immediately resume chest compressions for 2 minutes or 5 cycles of CPR, without checking for a pulse, because the heart needs continued support to circulate blood even after a successful shock. For instance, as soon as the AED says shock delivered, you should be ready to put your hands back on the chest and restart compressions. Remember that compressions are always the priority and should be resumed without delay. Question 17. In a 2-rescuer adult CPR scenario, how often should rescuers switch roles, compressor and ventilating? A. Every 5 minutes. B. Every 2 minutes or about 5 cycles of CPR. C. Only when the compressor becomes fatigued. D. When EMS arrives. Answer: B. Every 2 minutes or about 5 cycles of CPR. This question evaluates your understanding of effective team dynamics in a 2-rescuer CPR scenario, specifically regarding switching roles. The keywords "to rescuer adult CPR" and "how often should rescuers switch roles" point to the guideline for maintaining high-quality compressions. Rescuers should switch roles every 2 minutes or approximately 5 cycles of 30 compressions and 2 breaths, even if they don't feel tired, to prevent fatigue and ensure consistent, high-quality compressions. For example, one rescuer counts out loud while doing compressions, and at the 2-minute mark, they smoothly switch positions with the other rescuer. Regular switching prevents compressor fatigue, which is crucial for delivering effective CPR. Question 18. What is the appropriate action if a conscious adult who was choking becomes unconscious? A. Continue abdominal thrusts. B. Place them in the recovery position. C. Begin CPR, starting with chest compressions. D. Check for a pulse for 30 seconds. Answer: C. Begin CPR, starting with chest compressions. This question tests your knowledge of how to manage a choking victim who progresses to unconsciousness. The transition from conscious and choking to becomes unconscious is the key indicator for changing your intervention. If a choking victim becomes unconscious, you should immediately activate the emergency response system if not already done, and then begin CPR, starting with chest compressions. For instance, after helping a choking adult who then collapses, you would gently lower them to the ground and start chest compressions, looking for the object in their mouth before giving breaths. When a choking victim becomes unconscious, the treatment shifts to standard CPR to address the potential cardiac arrest. Question 19. What is the purpose of placing an unresponsive, breathing victim in the recovery position? A. To make it easier to perform CPR. B. To prevent aspiration, choking on vomit or fluids. C. To provide comfort for the victim. D. To encourage blood flow to the brain. Answer: B. To prevent aspiration, choking on vomit or fluids. This question focuses on the specific purpose of the recovery position. The keywords unresponsive, breathing victim, and recovery position are important, as this position is only used when the victim is breathing adequately. The main purpose of the recovery position is to help keep the airway open and to prevent aspiration, which is when vomit or fluids enter the lungs, by allowing fluids to drain out of the mouth. For example, if someone is unconscious but breathing normally after an overdose, gently rolling them onto their side helps protect their airway. The recovery position is a crucial way to protect the airway of an unconscious person who is still breathing. Question 20. When should you avoid placing an AED on a victim? A. If the victim is wet. B. If the victim has a hairy chest. C. If the victim has an implanted pacemaker or defibrillator. D. You should never avoid placing an AED if indicated. Answer: D. You should never avoid placing an AED if indicated. This question addresses potential challenges with AED use and reinforces that these should not prevent defibrillation. The concept being tested is that an AED is a critical life-saving device that should be used as soon as it's available for an unresponsive, non-breathing victim. While conditions like a wet or hairy chest or an implanted device might require minor adjustments, like drying the skin, shaving hair, or adjusting pad placement, you should never avoid using an AED if it's indicated. For example, if someone has an implanted pacemaker, you would simply place the AED pad a few inches away from the device. Remember, potential challenges can be managed. The priority is always to deliver the shock if advised. Question 21. What is the correct way to open the airway of an unresponsive adult victim suspected of having a spinal injury? A. Head tilt, chin lift maneuver. B. Jaw thrust maneuver. C. Lift the neck with one hand and pull the chin with the other. D. Do not attempt to open the airway if spinal injury is suspected. Answer: B. Jaw thrust maneuver. This question tests your knowledge of airway management for an unresponsive adult when a spinal injury is suspected. The keywords unresponsive adult victim and suspected of having a spinal injury are critical, as they dictate a modified technique. The jaw thrust maneuver is used in this situation because it opens the airway without extending the neck, thereby minimizing movement of the spine. For instance, if a person has fallen from a height and is unresponsive, you would place your fingers under the angles of their jaw and lift to open the airway. Always prioritize opening the airway, but be mindful of potential spinal injuries by using the jaw thrust. Question 22. What should you do if an adult victim you are performing CPR on suddenly starts to breathe normally and move? A. Stop CPR and check for a pulse for 1 minute. B. Immediately place them in the recovery position. C. Continue CPR until EMS arrives. D. Deliver one more cycle of CPR before stopping. Answer: B. Immediately place them in the recovery position. This question evaluates your response to a victim who shows signs of recovery during CPR. The phrase "suddenly starts to breathe normally and move" indicates that the victim is no longer in cardiac arrest and no longer needs compressions. If a victim begins to breathe normally and move, you should immediately stop CPR and place them in the recovery position to protect their airway until advanced medical help arrives. For example, if after several rounds of compressions, the person gasps and coughs, indicating they are now breathing, you would carefully roll them onto their side. Your priority shifts from providing compressions to protecting their airway once they are breathing effectively. Question 23. What is the primary method for opening the airway of an unresponsive victim with no suspected neck injury? A. Jaw thrust maneuver. B. Head tilt, chin lift maneuver. C. Using an oral airway device. D. Lifting the shoulders. Answer: B. Head tilt, chin lift maneuver. This question focuses on the standard, most common technique for opening an airway in a victim without suspected spinal injury. The keywords primary method and no suspected neck injury are important, indicating the go-to approach. The head tilt, chin lift maneuver is the quickest and most effective way to open the airway by lifting the tongue off the back of the throat. For example, if you find someone unresponsive on the floor with no signs of trauma, you would gently tilt their head back and lift their chin to ensure their airway is open for rescue breaths. Always use the head tilt, chin lift maneuver unless you suspect a neck injury. Question 24. Which of the following is a sign of an opioid-associated life-threatening emergency? A. Rapid heart rate and flushed skin. B. Pinpoint pupils and slow, shallow breathing or no breathing. C. Excessive sweating and dilated pupils. D. Seizures and aggressive behavior. Answer: B. Pinpoint pupils and slow, shallow breathing or no breathing. This question tests your ability to recognize signs of a life-threatening opioid overdose, which has specific indicators. The key phrase opioid-associated life-threatening emergency points to the unique symptoms of opioid toxicity. Pinpoint, very small, pupils, along with extremely slow, shallow, or absent breathing, are hallmark signs of an opioid overdose and indicate a critical need for intervention. For example, if you find someone unconscious with tiny pupils and barely breathing, consider an opioid overdose. Recognizing these specific signs is crucial for immediate response, including calling EMS and administering naloxone if available and trained. Question 25. What is the recommended chest recoil during CPR compressions? A. Partial recoil, as long as compressions are rapid. B. Full chest recoil after each compression. C. No recoil, keeping pressure on the chest. D. Recoil only after every 5 compressions. Answer: B. Full chest recoil after each compression. This question highlights another crucial component of high-quality CPR, allowing the chest to fully re-expand after each compression. The term recommended chest recoil emphasizes the importance of releasing pressure completely. Full chest recoil after each compression allows the heart to refill with blood between compressions, which is essential for effective blood circulation. For instance, imagine squeezing a sponge. You need to allow it to fully expand again to absorb more water before the next squeeze. Always ensure you lift your hands completely off the chest after each compression, without losing contact with the skin, to allow for full recoil.